Hello, everyone. Today, Dr. Hina and I will talk about lung cancer. Since 2012, Lung Cancer Day is celebrated on 1st of August every year. The day is celebrated to raise awareness about lung cancer and promoting lung health, and to highlight the prevalence, impact of lung cancer, which remains the leading cause of cancer death worldwide. The Lung Cancer Day is also celebrated to promote the importance of early diagnosis and screening programs to improve patients' outcome, inform the public about risk factors such as smoking, exposure to harmful substances, and also to advocate for increased funding and research to develop better health treatment and finding a cure. So today we will learn about all these aspects from Dr. Hina Jawaid, who you know very well. So, Dr. Hina, welcome to the podcast.
Thank you.
So, let me
Right.
start by the first question. As I understand, there is every year there is some theme of lung cancer. So, what is the theme of this year, Lung Cancer Day?
Okay. So the Lung Cancer Day for this year was celebrated on the 1st of August, and it's celebrated every year on the same date. And the theme is different, as you said. Um, this time it was focused on if we are united and we are stronger together, and united for lung cancer awareness. Um, so that was in the past years it was about say focusing on things like prevention of lung infections and focusing on the treatment modalities, reducing mortality and so on and so forth. But this year's theme is about focusing on the awareness, and I think that that is beneficial for places like global south or the lower middle income countries or the vulnerable areas. Yeah.
Thank you, Dr. Hina. So, coming next to lung cancer. So, what are the common risk factors for lung cancer?
Okay, I think if when we are listing the factors or linking the factors, various factors with lung cancer, it's important to know that it's not only one factor that can lead to it, but it also depends on your in general lifestyle, your general health as well. And it is also stated in the literature that deprivation or low socioeconomic areas with has the potential of generating more cases of lung cancer as well. Um, it's also important to know that majority of lung cancers are preventable. So if we look into the factors that are linked to it, the topmost is smoking.
Mm-hmm.
Um, and then followed by occupational exposure. So people who deal with things like aluminum production, asbestos, silicon, nickel, hexavalent chromium, coal mining and stuff. So the fumes can lead to or can lead to development of a cancer. Uh, Diet, particularly red meat, processed meat, alcohol intake. And again, that's part of the lifestyle and how healthy you are, and if you have any comorbidities or any other triggers. In terms of developing, like linking with the family history, majority are not inherited.
Okay.
Majority are developed like within an individual, mostly with no family history. And a very small percentage, there is the risk of inheritance or a development of a inheriting of an abnormal gene is there. And sometimes it's part of a syndrome where you get other types of cancers or diseases as well. And then that's where the screening comes in. But even then, if people who are developing lung cancer with no family history, when you look at the causes, most of them are preventable. Okay. And then air pollution, the risk is about less than 10% of it contributes in the development of lung cancer out of the global figure.
Mhm.
So these are some of the risk factors, and you can work out that most of them are preventable if you're aware.
Thank you, Dr. Hina. And most of the risk factors that you just stated, they're highly prevalent in South Asia and countries like Pakistan. So it's good to know that they are preventable. So tell me, when should lung cancer be suspected based on patient history or occupational exposure?
Okay, so when a patient comes to us with complaints like pain in the chest, breathlessness, recurrent infections of the chest, and then there are red flag signs, which means if the patient is saying, I'm coughing up blood in the sputum, I'm losing weight, um, and as I said, breathlessness and chest pain. And then there are other symptoms as well. Um, Feeling tired, lethargic, so possibly developing anemia. And even in this, you can also suspect this in people who are passive smokers as well. Because in clinical practice, we do notice people who come in with never smoked, but they are working in an environment where they are inhaling the cigarette smoke, the fumes. They are themselves not smoker, but the surrounding is full of people who are. And passive smoking, and there have been reported cases of lung cancer in passive smokers as well. The other thing I wanted to mention here is things like vaping, which are now in the market as an alternative to nicotine-free cigarettes and stuff. So they also contain volatile substances in the vapors that can cause, that can be linked to cancer and that can lead to development. So all those people who are vaping, I would advise them to not go too far into it, or don't use it for a long period of time, and make sure your health is generally okay. Because as I said, there are volatile organic compounds in it called like something called benzene, which is present in the fumes and the vapors, and when they are inhaling it, that is being linked to or associated with high risk of lung cancer.
Thank you, Dr. Hina, for this. I know of a person who used to smoke and he went on vaping, and I found out that so when he started vaping, his symptoms got, so he started getting breathless and all that. And one of the reasons what we figured out was that when you smoke, so there are a number of cigarettes that you smoke, but with vaping, people take vaping very lightly. So they don't know how much nicotine or the harmful substances that you just mentioned they're inhaling, and that leads to further more damage than I think smoking. So yeah, so that's a very important point that you raised.
Yeah.
Dr. Hina, what are the different type of lung cancers?
Okay, if we divide them broadly, one is called a non-small cell lung cancer, and this is based on the histology or the microscopic examinations and stuff. So the non-small cell lung cancers are most common, but they spread to other organs very slowly. So you have the margin of getting them detected before they spread. The other type is a small cell lung cancer. They are rare compared to the non-small cell lung cancers, but they're spread to other organs. For example, liver, bones is faster than the non-small cell lung cancer.
Okay, so there is a high metastasis of that cancer.
Yeah.
Right. And what, so you were talking about screening also, but what are the broad categories of investigation or screening tests that are available for lung cancer?
Okay, so we start with basic. In general practice, we start with something basic called chest X-ray. Sometimes when patient comes with us, presents with symptoms of pneumonia, and obviously there's a patch of infection there as well. And sometimes if the suspicious lesion, it may hide it. So it's best to re-X-ray in about 6 weeks' time when the consolidation and the effects of pneumonia have gone. So chest X-ray is definitely. And then if you're suspecting it from the history, then you refer the patient to a specialist, a pulmonologist, and they arrange tests like CT scan or PET scans. And depending on where the site, the size, and whether there's a spread, they do further investigation, because you need to establish the histology. You need to know what type of cancer it is. So they do something which is invasive called a bronchoscopy, in which they put a camera down the throat into the airway in order to get to the lesion, and then take biopsy from there. You can also do ultrasounds and percutaneous procedures. So that's broadly the different types of investigations. Yeah.
But they're all done. So except X-ray chest, most of them are done with specialists, right?
I would also like to add here that we tend to do, because a patient come with the multiple symptoms. So
Mm-hmm.
we also tend to do baseline bloods, like looking
Okay.
for checking for anemia or infection. So
Okay.
complete blood count. It's good to do the entire thing. Make sure the patient is not diabetic, has a high cholesterol, liver, kidneys. That bit is also checked. If
Okay.
they are if you're suspecting blood in the, or patient is saying there's blood in the sputum, then it's best to check for clotting profile as well, and make sure patient is not bleeding from any other side, just to ensure that. Yeah.
All right. Thank you. So for the treatment that you were talking about, so what type of treatment options are available for such patients at the primary care level and at the hospital also?
Okay. So the primary care is mainly dealing with early identification and referral of the suspected cases to the higher centers. Okay.
Mm-hmm.
So as I said, we do the baseline bloods and the chest X-ray
Okay.
to start off with. And then depending on the site, size of the tumor and patient's health conditions,
Mm-hmm.
there are different treatment options, and the histology as well, and whether it has spread to other organs or not.
Mm-hmm.
Um, there's chemotherapy, there is radiotherapy, there is surgery, there's ablation,
Okay.
and if patient is terminally ill, then obviously supportive care and so on and so forth. Being based in primary care, we have got GPs, qualified GPs, who have got further qualification in palliative care, so they can offer support. However, I understand not every GP has got a postgraduate qualification in palliative care, but in those cases, there are resources, there are centers where they can take advice from and have a network of support as well. So yeah.
Thank you, Dr. Hina. So about these patients, so when they come to family physicians, and you said that um, uh, the you're involved in prevention and early detection. How does
Mhm.
early detection impact lung cancer outcomes?
Okay, well, if the detection, if you detect it early and if you detect it at an earlier stage, then the risk of mortality declines. Um, and if it is in a certain condition where, say, it's in the earlier stages, and it's surgically, if it's removed or through chemotherapy or radiotherapy, the lesion shrinks. All you have to do is then make sure the patient goes for annual visits and is aware what kind of symptoms to look for if you're worried about recurrence. But overall, early detection is associated with reduced mortality and morbidity as well.
So, do we have screening programs in Pakistan and South Asia region?
Right. Broadly speaking, I'm not aware of any
Okay.
in the public sector. However, in private sector, they may offer screening packages. Like a lot of institutions in private sector, they offer, for instance, breast screening during the month of October. So the packages are there. But sometimes certain institutions say, oh, we've got a package of so and so blood test and an X-ray or an ultrasound.
Okay.
So but then that's patient's own initiative if they are willing to pay for it and stuff.
All right.
But
So
nationally, we don't send
no
letters.
publicly funded. Yeah. Uh, that's quite understandable. So coming back to family physicians, how can family physicians support patients and their family through lung cancer diagnosis?
Okay, now that's challenging. It's challenging not only for the family physician, but also for, and I'm talking in context of the current state of primary care in the country, and obviously our socioeconomic condition, and depending on the level of the education, the level of the financial constraints a family is facing. It's a difficult ride, but as I said, nothing is impossible. From the very beginning, when the diagnosis is disclosed, and for example, the patient is needs only supportive care, that's the only thing you can give him or her, say that out loud in the first meeting. Make sure the family and the patient is aware of the ground reality and the facts and what is there to come. They'll probably be well prepared. I know patients freak out, they worry, but do give them hope that we are there to support you. I may not have the answer right away, but I will help you find out. And that is where we need the Macmillan kind of a support, the specialist cancer nursing support, and the teams that we need to build up. And that can only be done if primary care physicians be the voice of the patients of the community in the community where they're practicing, and liaise with the specialist. I think having a strong network of primary care physicians and then them having a united voice for their patients as advocates will add to the awareness. I know we celebrate the awareness for a day only, but the cases of lung cancer come throughout the year. So in our part of the world, the advocacy campaign has to run throughout the year, basically. Yeah.
Yeah, so patients do need emotional support. I mean, just the name of cancer is such a traumatic
Yeah.
experience. If someone tells you you have cancer, and people think that that's the end of the world for them.
Yeah.
And I think you're right. Family physicians have a strong role to play here. So you were talking about lifestyle changes also, and I'm really interested to find out what lifestyle changes can help reduce the risk of lung cancer.
Okay, so I think staying healthy,
Yeah.
make sure there are other diseases that are preventable. Smoking is something, if you can get rid of, best. I've seen people who are smoking two cigarettes at the same time, like so much addicted to cigarettes, but appropriate counseling can help them decide. There are medications which can help them quit smoking, but again, they are not easily available. And by easily available, I mean only the affording can get it.
Mhm.
But then I've seen cases where patients smoking more than 2 packs a day, 20 each, once they have decided to quit smoking, they just do it like that. They don't even taper it off. They
Mhm.
just do it because they have made up their mind. So there are cases out there. It just You have to keep trying and trying, and sometimes your statement hits them hard enough to kind of quit smoking. So smoking is something which they can generally staying healthy, like making sure you take out 20 to 40 minutes every day for yourself. Go out for a walk. You don't have to jog or run. It has to be a brisk walking, enough that you sweat so your weight is maintained. Don't consume too many sugars, because remember, people who have had cancers, they are even advised to reduce sugar intake,
Okay.
because yeah, then it reduces the chances of recurrence, and
Okay.
so staying healthy, basically.
Mhm.
Make sure your cholesterols are within the range, make sure your blood pressure is okay, your heart is healthy, and
Mhm.
you are generally healthy. So whenever God forbid, if anybody develops cancer, your rest of the health is good enough to kind of take the stress of the treatment, and your chances of recovering from it is increased. And be aware as well of what's happening, what you need to avoid. Occupational exposure is a hard one. You can't always tell the patient change your job, but are there any measures they can take, like special form of masks to reduce inhalation, or any something like that? Then it's best to discuss with their employers and find out. Yeah.
So Lahore is quite high. I mean, whenever I look at Lahore or Dhaka or Bangla or Delhi, so they're very high on air pollution, particularly in some months of the year. So would that also be a risk for lung cancer?
Well, if as I stated, the previous figures were around, again, this is preventable. So 7.8% is the figure where air pollution is contributing.
Okay.
In terms of preventing it, now, again, you have to ensure your own health is good. Even if it's not causing cancer, it is giving rise to respiratory tract infections,
Yeah.
either upper airway or lower airway, depending on how good your immune system is,
Mhm.
how your body fights with the infection.
Mhm.
So, and on top, if you're smoking, then that adds to the problem.
Mm.
So, I think, again, staying healthy, and in terms of air pollution or water pollution or land pollution or any form, my message to the listeners would be: raise your voice about it, be more aware, be aware of what's happening around the world about it. There is a lot of information on the internet. I know we all have access to mobiles and the internet. So make sure you utilize that time to keep yourself well informed and be part of the advocacy campaigns for preserving the climate as well. So yeah, but thank you for raising that question. That's important. Yeah.
Thank you, Dr. Hina. Okay, now a final one. We'll have some other side questions, but the final one, what resources are available for lung cancer patients and their families in Pakistan and in South Asia as general?
Resources for patients in terms of information, you mean?
Yeah, so for
Okay.
instance, any support services, any educational material, any organizations that are working in that area which can provide these patients support. You were talking about palliative care, any such support that these patients can avail. So are there any local or international organizations that are providing such services, or the government-led support services?
Okay. Well, internationally, there are a number of ones like Cancer Care Society. Um, uh, in UK, there are plenty of them. In the USA, there are plenty of them. And if the patient is educated, you give them the web link address or websites like patient.co.uk, which has got information about complete information of why you get it, what can you do to prevent it, what are the different treatments available, and how you can stay healthy, and so on and so forth. So if the patient is educated, yes, we can signpost them. Within the country, at times I even struggle, but specialist centers or places like oncology centers, they'll be the best people to guide. You can take advice from them when you go
Mhm.
for your treatment. Your oncologist can guide you. For palliative care, again, it comes down to the affordability because it's only in the private sector. So we do have the contact numbers of those who are willing to take. Mind you, in Pakistan, because of a lot of brain drain, there are plenty of people who have moved abroad, including
Mhm.
doctors. Their,
Mhm.
their elderly parents and family members are still here, and they at times contact us from outside Pakistan and ask us to kind of signpost them. So again, it's always the private sector that we tend to find the information from. But then there are NGOs and there are other funding processes that one can find out. It's just that you have to initiate the talk. Um, Possibilities do come. You may not find the possibility there and then immediately, but uh, sometimes you have to kind of struggle a bit, spend more time in it, and then get to your required
Mhm.
information. Yeah.
Okay, so one of the first patient that I remember of lung cancer was when I was doing my internship, and there was an old guy who came, and we were taking the history. So there was no recent history of smoking, and I think he quit smoking 20 years ago. And he came with quite advanced stage of lung cancer. So what are the chances that a person quits smoking and then he still gets, because what the a lot of uh, data and also a lot of websites say that once you quit smoking, so you rapidly go back to your non-smoker state. So is that your experience also with people who are ex-smokers? Do they get lung cancer also?
Um, we say that if you quit smoking, um, okay, if I tell you the figures, if a man, in terms of genders,
Yeah.
in a lifetime, however number of years you are to live, a man will develop lung cancer in his lifetime. It's about 1 in 16. So if
Okay.
16 men are standing, one will develop lung cancer,
Okay.
right? And for women, it's 1 in 17, right?
Right.
And these numbers include people who smoke and those who don't smoke.
So
So
smokers also?
yeah.
Okay.
So these figures are for both.
Okay.
Yeah. Obviously, now with this background risk, if somebody who's a smoker, you can say the risk is a bit higher.
Higher, yes.
For that person, the risk would be, say, maybe,
Twice?
yeah, maybe twice or
Oh no,
thrice,
yeah.
depending on the
Okay.
smoke, what environment. As I said, if there is socioeconomic deprivation, because
Yeah.
then health becomes compromised as well.
Yeah.
If you have a compromised health, then the risk of damage within the cellular level and the organ level is a bit higher.
Mm-hmm.
If we go down to like basic sciences and stuff, then yeah.
Okay. So anything else that you want to tell your listeners about lung cancer that I haven't asked you?
Okay, I think we've covered a lot of ground. This is just a basic information to sensitize them. And I think my to all the listeners, whether doctors or non-doctors, is not it's not only lung cancer, just but be aware of what's happening as we are growing up. I know we've got a lot on our plates already, but awareness can save you. So make sure if you are suspecting something within yourself or somebody within your family and you think it's not right, it's best to get checked. Go to see your local doctor and ask them questions about the disease, about what to do next, investigations, the treatment, and stay on top of the information. Don't just be dependent or rely on one individual. Always check and cross check and make sure you've got the right information. But don't be afraid to ask the question from your doctors and be more aware. Yeah.
Thank you. And if there is just one takeaway message that you want to give in addition to what you already said.
Yeah. To the population, to the doctors or
Yeah, to the
the non
to the family physicians.
to the family physicians, stay up to date with knowledge, attend as many CMEs as you can. Primary care workforce has to be robust because you are the voice of the community you are based in. And you have the power to affect the lifestyle of an individual. Because in our part of the world, or rather rest of the world globally, people like to listen to the doctor. So the doctor has got to be at the highest level of awareness and knowledge. Yeah.
Thank you very much, Dr. Hina. I'm sure that the listeners would learn a lot. I've learned a lot. I always learn a lot from you. Thank you very
Perfect.
much. We'll talk again pretty soon. Thanks.
Inshallah. Okay.